Okay. Hi, my name is Asha Taylor, and this is my health assessment video. We're gonna go ahead and get started, okay? All right. So first of all, I'll provide patient privacy. Come in, close the door, close the curtain, the screen, whatever I need to do in order to provide privacy. And I will be washing my hands. I've already taken her vital signs. Her temperature was 98.8, blood pressure was 130/72, heart rate 71. Pulse ox 99% on room air. She denied any kind of pain, and we're ready to get started. Okay. All right. So hi, Miss Lewis.
Hello.
Hi, my name is Asha. I'm going to be your nurse for today, and we're going to go ahead and get started on your health assessment, if that's okay with you.
Okay.
All right. Can you state your full name and date of birth?
Yes. Cynthia Lewis, 7761.
Okay, good. Do you know where you are right now?
Baptist Health, Little Rock.
And what? Okay, yes, Baptist Health Little Rock. And what time of day is it?
It's around 1 o'clock p.m.
Yes, it is. Okay, and I'm going to give you 4 words that I need you to remember. They're 4 non-related words. It's just to assess your short-term memory. And I'm going to ask you again later on in the assessment, okay? So the 4 words are dog, hat, chicken, steps. Can you tell me those words back?
Dog, hat, chicken, steps.
Yes. I know, it sounds kind of weird. Okay, so I've already washed my hands, and I am going to go ahead and start with her head. So we're going to start at the scalp and make sure that she has a normal distribution of hair and that her scalp is intact, okay? All right, let's get started. So going to feel around, feeling for any lumps, bumps. I'm looking at the color of her scalp. Her scalp is tan. I don't see any open areas, any sores. I don't hear any complaints when I'm pressing in to feel for any lumps, bumps, or bruising anywhere. I don't see any bruising. There's an even hair distribution. Her occipital lymph nodes are not palpable. Her post-cervical lymph nodes are not palpable. Pre-auricular, post-auricular, cervical lymph nodes, and supraclavicular lymph nodes are all non-palpable, which is good. Okay, so I'm just going to look at her face. I'm looking for facial symmetry. I'm looking for color and distribution. Also of hair. I'm looking right now at her eyebrows. She does have eyebrows. Also, she does have evenly distributed eyelashes as well. We can go ahead and start on her assessment of her eyes. Okay, so we're going to assess her ocular nerve. Her optic nerve. Okay, and what I want to get you to do is I want you to look at my name badge and spell my name. Okay, can you do that right here?
Asha.
Okay, and also, could you cover your right eye for me? All right, I'm going to get on this side. All right, cover your right eye and take a look at my badge, and can you read this word?
Baptist.
But yeah, I just wanted you to read the word, that's fine.
Oh, Baptist.
Yeah.
Sorry.
Okay. And on this side, I want you to read the rest of this word, if you can.
With my eye?
No, the other eyeball.
Oh, sorry.
Oh, Miss Lewis. Okay, go ahead.
Health.
Yes, yes ma'am. Okay, so I'm going to be checking for her extraocular movement, and I'll be assessing her ocular, trochlear, and also her accessory. Is it ocular, trochlear, and accessory nerve? Okay, I'm gonna go for it. Right here, it's an eye assessment. It's just to see if she can follow my pen with her eyes. Can you follow the pen with your eyes? Okay, continue to follow it. Awesome. All right, and I'm going to make sure her pupils are able to accommodate light. Okay, and if you could just look towards me, I'm going to scan your eye really quickly with the pen light. All right, and her pupils are reactive to light. Her pupils are probably about 3 millimeters in size, and her eyes are free of any kind of drainage or exudate. Her conjunctiva is nice and pink. It's not inflamed at all. Also, her sclera is white. And she has an even distribution of eyelashes on the top and the bottom of her eyes. Also, what I want to do is I want to check her olfactory nerve. So what I'm going to do is I'm going to have you to close off one of your nostrils and take a deep breath in through your nose. Okay? And I'll then do the same thing on the other side. If like you're having any kind of trouble breathing at all on either side.
No.
Okay. And I'm going to take a look inside of her nose to look for patency. And she does have hairs inside of her nasal passages. Also, both sides are not occluded. And then I'm going to test for your sense of smell. Okay, so what I'm going to do is I'm going to give you something to smell and you tell me what it smells like, okay? Close your eyes for me. Alright, and just inhale. And did you smell anything at all?
Mm-hmm.
And what does it smell like?
Vanilla.
Yes, vanilla. Okay, also, I would like to palpate her sinuses. So I'm going to palpate her frontal and maxillary sinuses. Do you feel any pain or tenderness when I palpate, when I press up against your cheeks and your face?
No.
No, she doesn't feel any pain. Okay, let's move on to your lips and her mouth assessment, okay? So if you can open up your mouth for me, I'm going to take a look. Okay, and stick your tongue all the way out for me. All right, and right now what I'm doing is I'm assessing her glossopharyngeal vagus and also her hypoglossal nerves. And her uvula does rise and fall. Can you say "ah" for me? All right. And she does have tonsils. They are free from any kind of drainage or exudate. They look nice and pink. They're not swollen at all. I would say they're +1. Also, I'm going to take a look at her neck just to see if the trachea is midline, and it is. Also, I'm going to look at her oral mucosa, and her skin on her lips is nice and pink. It's not dry or cracked at all. Let's see. I'm going to go ahead and palpate the rest of her lymph nodes. So we have pre-auricular, post-auricular, cervical, I think I already did this, supraclavicular as well, and occipital lymph nodes. Also, I'm going to take a look inside of her ear. I'm going to whisper a word and you let me know if you can hear the word that I whisper to you. Can you close your left ear?
Yes, Baptist.
Okay, she said the word. It was Baptist. Okay, and if you can close off your right ear, I'm gonna whisper inside of the left, and we're just checking for her uh, cochlear nerve. Okay.
Yeah.
Okay, Baptist Health. That's absolutely correct. Uh, let's see. I'm gonna look inside of her ear to see if I see any foreign bodies, if I see any swelling, any redness, and if I have an otoscope when I look inside of her ear, what I would notice is just looking for any kind of abnormalities, which I don't see any, and what we would be looking for is a pearly gray tympanic membrane in her ear. And do you feel any kind of pain or tenderness when I kind of tug at your ears at all?
No.
No pain, no tenderness. Also, I wanted to test out a few more of your facial nerves. Can I get you to clench your teeth together? And when she clenches her teeth, it's even, and that's just testing out her trigeminal nerve. Also, I'm checking for any kind of facial drooping or anything that would suggest weakness on either side of her face, which she has none, and that is going to test for her facial nerve. Can you press up against my hand with your face? Okay. And press on this side. Okay. And also, this is her accessory. I think I said accessory earlier for her eye, but I meant abductans. This is her accessory nerve. I want you to press up against my hands with your shoulders. Just shrug the shoulders. Okay, good. Wonderful. Her cranial nerves are intact. Also, now what I wanted to do is just to begin her assessment of her vascular system. So we're going to check for her fingernails and look and take a look. I can see her lanula. Her nails are smooth and convex. Also, let me check for capillary refill. And that's something that you would check for on both sides. Check over here. So far, so good. Her capillary refill is intact, and I'm going to palpate her pulses. So, temporal pulse, and I'm doing it one at a time. And she does have a carotid pulse as well on both sides. And I'm going to take a listen for a bruit of her carotid artery. And when I do that, I'm going to ask Miss Lewis if you could just hold your breath when I tell you, okay, for just a quick second. All right, go ahead and hold your breath. You can let it go. Okay, and I'm going to check over on this side. Hold your breath. And let it go. All right. Wonderful. And I do not hear a bruit. Just checking to see if your carotid arteries are patent, and they are. Also, let's see, what else did I want to do? I guess we'll just go ahead and start taking a listen to her lung sounds. So, all right. We'll start up here, and if you could take a deep breath for me in through your nose and out through your mouth. In through your nose, out through your mouth. Just continue taking deep breaths. Continue. And her lung sounds so far are clear. I don't hear any kind of crackles or wheezing, rales, bronchi. I don't hear any of that. All right, continue just taking deep breaths. And Okay, and if you can hold your arms away from your sides, I'm going to listen from side to side, comparing each side. All right, take a deep breath. Keep breathing. Okay, and again. Deep breaths, okay. All right, now I'm gonna go around to the back of Miss Lewis and I'm going to listen to her posterior lung sounds. All right. All right, can you take a deep breath for me? Deep breath. Keep going. Do deep breaths. You're doing a wonderful job. Deep breath. Okay. And again. Keep taking those deep breaths. So far, her lung sounds are still clear. Okay, and now I'm going to be testing for tactile firmitus. If you could, can you say 99 as I press on your back?
99.
Okay, and again?
99.
Okay, and then I do feel the vibrations when she says the phrase 99, or the words 99. And I'm gonna check for,
JK broke your charger.
go. Go. Okay.
Y'all stand in my room.
Now, I'm going to get you to turn towards the camera, so put your legs this way. Uh-huh. Okay, and now I'm going to just do an assessment to see if she has symmetrical lung expansion. So, if you could take a deep breath for me, just in and out. Okay, in again. And out, and she does have symmetrical lung expansion. If you have any questions, comments, or concerns, you just let me know.
Okay.
Let's see. Just checking for her skin turgor. Her skin turgor is good on her hands. I don't see any tinting, as well as the skin turgor on her chest. When I pinch it, it's just fine. Do you have any questions, comments, or concerns? No? Okay, well that concludes our physical assessment for today.
Okay.
All right, thank you.